Hey everyone, on this episode of the Daily Dental Rewind, we're going to talk about what a proper bite should look like and what it shouldn't look like. Run the intro. All right, hey everyone, welcome back. I'm Dr. Jordan Kane Smith, and on this episode, we're going to be talking about a patient from today. He had arrived from concern as a new patient saying, I'm noticing that a lot of the recession around my teeth is seeming to get worse over the last couple of years. And so through that discussion of dialogue, we took a 3D scan of his teeth and we pulled that up and we started talking. So I'm going to use this case as an example to show you a couple of things about how a proper bite should fit together and the consequences of when it doesn't. So I'm going to flip over here. We're going to talk about his iTero scan. So here is his teeth and the orientation of them. It probably doesn't look too odd to many of you, but I will say that we're going to flip over to more of the stone model look. But when we look at a proper bite, one thing we should notice is that the top teeth are kind of like the lid to a box. They should actually overlap the bottom teeth. That's important because the bone and architecture that support the teeth are designed to actually have the teeth work in that way. So there is actually a way that the enamel, the cusps together on the top and on the bottom should work in order to maintain not only the bone strength and the health of the tooth, but to also complement the muscles, the joints, and things of that nature that are all part of this system. So remember that. When we look over at his bite and we look at the recession, I'm going to flip the color back on just real quickly. The areas of his concern were more about these areas here around the roots where you're actually beginning to see the tissue pull back. And that's always an indication that the bone is pulling back. So you'll never see tissue pulling away from bone that's still there. So if the tissue is pulling back and we're seeing roots begin to show of the tooth, it also means that the bone is actually atrophying as well. And many of the times, just as is in his case, if we are putting too hard of a force sideways on a tooth, that can cause the bone on the outside, which is fairly thin, to begin to break down because of that excessive load, and that's exactly what's happening here. So when we look at his bite, I'm going to turn back on this model screen here. It's just a little easier and cleaner. We're going to turn on the colors of his bite. And so one of the nice things about this machine is it allows us to look and analyze the contacts. We want to see exactly where are your teeth hitting one another. Now on the upper teeth, the idea of the premolars and the molars are that you should have all your contacts mainly on the inside of those cusps and then right in the middle of the tooth at the most there. So what I mean by that is we should see all the cusps hitting here on the inside, and on the inside, and possibly right here in the central groove, as we call it. What we don't like to see is any on these molars or premolars, any contact on the outside cusps. Now, as you see, the more contact, the more orange and yellow and red it turns. And in his case, you can see how much of his outside teeth are actually touching on just a normal bite. Same thing for the other side. If we flip it over to the bottom teeth, the rule switches. So on the bottom teeth, we should see all of our contact hitting on the outside of our cusps. So divide the teeth in half, and we should only be hitting really on the outside cusps 100% of the time. And in his case, you can see on the inside of this tooth, this tooth, this tooth, this tooth, as well as this one, all of those are hitting on the inside cusps as well. So again, the downside of that is as your teeth are chewing, and you chew more like a cow than you do an alligator. So in these sideways motions, we call them excursive movements, you will often hit those kinds of edges, and the bone, again, is not designed in the architecture of it to maintain support from a tooth that's being teeter-tottered in that direction. And so one of the most common things that we see in a case like this is we're going to see a lot of atrophy of the bone and, again, recession, which was his main concern. Let's talk just for a second on why a bite looks like this. Now, I'm going to jump into kind of a myofunctional mindset here because you'll see that, again, his top teeth are actually inside and less wide than his bottom teeth. I did ask him because I see this commonly. He had mentioned something about braces, and I do believe that he had a bonded wire on the inside, as you can see it there, a little easier when I have the color mode back on. But I said, it seems to me that you had orthodontics in the past. And he said, yeah, I did. And I said, let me ask you a question. Did you wear a palatal expander for your upper arch? And he said, yeah, I did that for a couple of months before we went into braces. And here's where I do get sometimes frustrated. I think palatal expanders have their purpose in life. But for many patients, the tongue is really your palatal expander. So when you're a young child from 4 to 12 years old, your tongue is the number one and one of the most helpful ways of expanding your upper arch and your teeth. The most important, of course, is nasal breathing, but that can't happen unless your tongue is actually in the roof of the mouth as well, and you're breathing through your nose. Flip that around. You can't put your tongue in the roof of the mouth without breathing through your nose. If you try to breathe through your mouth, your tongue has to drop. And so for many children that have palatal expanders, the first the first concern I have as a parent and as a clinician is if you have to have a palatal expander, your tongue's not in the right place and it's not doing its job. Every time. I don't think there's a rule that violates that or any way that you can get around that rule. With that being said, if you put a palatal expander in the roof of the mouth and it has that key that you turn to expand the arches, it will help expand the transverse side of the arch from left to right. But the downside is that appliance has now been in the roof of your mouth. So if you didn't have an issue with putting your tongue in the roof of the mouth and swallowing, which you probably did, you will now, because now there's been something stuck in that position and your tongue has had nowhere to go. So it's just learned by habit. I'm just going to stay down here next to the bottom teeth. And so it is very, very common for me to see adults with what we call crossbite, which is where the top teeth are inside the bottom teeth. And 9 times out of 10, they have a low tongue posture and a reverse swallow. But more importantly, many of them, if they've had any orthodontic efforts in the past, most every one of them has had a palatal expander. And so I always go back to it and I try to explain. And he was very intrigued by this, that the problem existed when he was young and we artificially fixed it for him, but nothing had changed in terms of his habits. So it all went back to the way it looked before he had a palatal expander. So any child of yours, or if you were an adult that had one of these as a child, be mindful that where your tongue goes, how it postures, how it swallows against the roof of the mouth, all that stuff is an immediate it's the most common reason for this issue, meaning that you're not doing those things properly. So anyways, that was his case. So we recommended a couple of things to help him with the recession. Recession being from a poor bite being from poor mouthfunctional habits. I said, hey, number one, let's get the habits back on track. So I sent him to see my myofunctional therapist to do a consultation, because it just said, listen, we can get the alignment back, which is my ultimate goal, is to get the alignment back into proper position to maintain the bone from here on out. However, if we don't have the habits corrected, there's never a chance that what I do is going to last. So key takeaway today, the bumper sticker. Oh yeah, don't forget to hit the subscribe button. It scared me again. If you're not following along with us, please do. Back to what I was saying. If you want the bumper sticker from today, it's remember that the way that your teeth fit together is a direct result of normally the habits that you have from a young age up until now. And without those being corrected, orthodontics is often a short-term correction and not a long-term correction and stable as it should be. So keep that in mind. Hope you learned something from his case today. Thank you guys always for following along. I had a wonderful day today. A lot of fun, a lot of general dentistry. Another day, another molar. I'll leave you with that. You guys have a wonderful one. I'll see you on the next episode of the Daily Dental Rewind.